Earlier this month, U.S. Surgeon General Dr. Vivek Murthy issued a warning about a growing epidemic of mental illness and mental health crises among children, saying, quote, recent research covering 80,000 people globally found that depression and anxiety symptoms doubled during the pandemic, with 25% of youth experiencing depressive symptoms and 20% experiencing anxiety symptoms. And on Face the Nation this Sunday, CBS's Jan Crawford weighed in on the disproportionate burden faced by children during the pandemic.
And now we have the Surgeon General saying there's a mental health crisis among our kids. The risk of suicide attempts among girls now up 51% this year. Black kids nearly twice as likely as white kids to die by suicide. I mean, school closures, lockdowns, cancellation of sports. You couldn't even go on a playground in the DC area without cops scurrying, shooing the kids off. Tremendous negative impact on kids, and it's been an afterthought. Yeah. It's hurt their dreams, their future, learning loss, risk of abuse, their mental health, and now with our knowledge, our vaccines, if our policies don't reflect a more measured and reasonable approach for our children, they will be paying for our generation's decisions the rest of their lives.
And Will, Amy, welcome to you. Welcome to you both. Will Juanda was a Democratic strategist and council member at large in Montgomery County, Maryland. Amy Tarkanian is a Republican strategist and former chairwoman of the Nevada State GOP. Thanks for being here.
Thanks for having me.
And so, Will, from your perspective as a county councilman, what types of children, what subsets of children are getting impacted by this the most, and who appears to be the most resilient?
Well, I think one of the things about COVID is that we have all been impacted, every age, every group, but it hasn't happened, of course, as we know, proportionately. And as you saw from the Surgeon General, there are groups that have had disproportionate impacts, and there have been deep, far-reaching impacts, and that's why our policy responses have to be deep and far-reaching. I agree that this issue has not gotten enough. It blips up every now and then, but it's a huge, huge, huge issue, and I think we'll be reading books about this, and kids are going to be writing them, and we're going to be talking about this for generations. The one thing I am happy about, though, is that kids are resilient. The father of 4 young children, I know I've seen that as well. But I think kids of color, low-income kids that had their parents have to leave the workforce or had to stay in the workforce because they were essential workers, kids that didn't have access to internet, our LGBTQ youth, go down the list. There's been a far-reaching, we had the Washington Post report here on test scores in our school system, which is the 15th largest in the country. We have 160,000 students. As you might expect, Black and Latino students under the standardized tests far, far behind. The gaps have been blown out of the water. And we've been trying to address that with a very robust targeted response for those students. But every student has dealt with something, and the mental health struggles, you saw the suicide numbers. And so we have to have a far, deep, and far-reaching and wide response for multiple years. That's why we're at a crisis point in funding of education. If people think we can just go back to funding education the way we did before, they're going to be sorely missing the point here. I think this is a time to supercharge our mental health resources in teacher pay, in psychologists and counselors. And we're trying to do that here, but that needs to be a federal, state, and local response.
Well, but Will, we just did that. We just gave schools $1 gazillion in COVID relief money that they can do basically whatever they want with. I don't think you could say that funding is not the school funding. The schools are funded more and more every year. School funding doesn't go down. They're getting tons of money. The problem is that the people, like in the relevant decision makers, did not prioritize students' mental health at all. And more money, I don't think, would have changed that. It was teachers' unions fighting with district officials saying, we don't want to be in the classroom, and it doesn't matter if that's going to be a year or two.
I think it's more complex than that. I mean, we personally in our county did prioritize student mental health and funded things throughout. But here's the other thing: if you want to get social workers and mental health professionals, there's a shortage nationwide. There aren't enough to go around. And go to a rural area, good luck. The pipeline and creation And that's connected directly to career pathways and funding of things like community college and getting people in those professions. So this is going to, and funding for 1 or 2 years, I'm sorry, but that's great, but that's not going to be enough. If this is far reaching, as the woman said on CBS, and I agree, this is going to have to be sustained funding, and we're going to have to change the way we do education. 1 or 2 year funding is not going to do it for this type of deep, deep learning loss and mental anguish that our students have gone through.
Amy, I heard you trying to jump in there. Go ahead.
Sure. Well, I think that I agree. Well, I know that I agree with Will in the fact that it did affect everyone. However, I think that despite your gender, despite your sexual orientation, despite your ethnicity, I think really it impacted the lower socioeconomic class the worst because, like he mentioned, you had parents who maybe were without jobs and maybe didn't have enough money saved in the bank. Maybe they weren't able to afford the basics. Maybe they couldn't afford the milk, the potatoes. Top ramen is still flying off the shelves where I live, and people are still panicking and they're trying to ration. But it did affect mentally, I would say, across the board. I saw it in public schools. I saw it in private schools. I saw it in kids who were being taught at home. It didn't matter what their setup was for education. The fact was everything was piling on and coming down on these children's shoulders. They felt apathetic. They felt hopeless. They felt the fact that they had not a bright future like they had envisioned at one time. Their thoughts of maybe playing sports in college gone. Being at the prom queen gone. Wanting to just do the basics and enjoy your peers and go to a football game gone. So they were devastated across the board, and it's still going to take some time to pick up the pieces because now you've got kids who have graduated or getting ready to graduate, and there's not the job offer that they had once anticipated waiting for them. Or maybe they're not even allowed to go and study on campus because for whatever reason they've chosen, or the family have chosen, not to become vaccinated, and they're not allowed to step foot on campus. I mean, there are so many different scenarios on why these kids are in a downward spiral, and it's devastating. And it has nothing to do with the amount of money that we're going to throw at education, because you were spot on with the fact that the teachers' unions are at fault. That happened in Clark County, which encompasses Las Vegas. And they are the ones who kept the kids out of school and complained, saying that their teachers didn't want to go back into the classroom when the rest of the state started to slowly go back into the classroom. It starts at the top.
Yeah. Go ahead, Will, quickly.
I'll just add, one of the things I think is imperative, and we've done here, and every jurisdiction should do, is keep schools open at this point. We know enough about the science and the data of how it impacts kids. Vaccines are widely available. We've kept our mask mandate in the schools as well. We do have to protect teachers and staff. We have a nurse shortage in this country. People trying to just administer testing and have the response. It's been really hard on our teachers, just like it's been hard on every professional. But we do have to keep schools open. I think that is we cannot allow these negative impacts to keep happening, because we know when kids are in school, they're getting meals, they're getting instruction, they're getting socialization, they're building back those skills. So that's a priority. That should be our number one priority, is to keep schools open.
And they're being taken care of, so their parents can work and put food on the table and all that sort of thing too. So amen. Thank you both very much for being with us. We appreciate it.
Thank you.
And we'll be right back with more Rising. Stay with us.